Hello everyone. We will learn fracture fixation and handling. Fracture is a sudden emergency in daily life. When we encounter fracture, how to deal with that? We must first remain calm and call emergency services immediately. Good fixation not only strengthens the reduction effect, but also promotes the speed and quality of healing. Breaking, pain relief, reduce the pain of the wounded, prevent the injury. Learning target. 1. Familiar with the definition, clinical features, on-site emergency procedures, basic elements of fixation and type characteristics of fractures. 2. Master the test point of fracture fixation and handling in the personal survival test. We will learn from the following. 1. Definition and clinical features of fractures. 2. First aid procedures for fractures. 3. Basic elements of on-site fracture fixation. 4. Types and characteristics of fractures. Part 1. Definition and clinical features of fractures. 1. Definition. A fracture is a break in the integrity and continuity of the phalanges. 2. Clinical characteristics. 1. Systemic manifestations, shock. 2. Local performance. 1. Pain. 2. Swelling. 3. Dysfunction, abnormal activity, false joints. 4. Deformity, shortened, angular or rotational deformity. 5. Bone fricatives. Part 2. First aid procedures for fractures. First aid procedures for fractures. 1. Hemostasis, such as open fracture. 2. Bind up. 3. Immobilization. 4. Carry. Attention. 1. Fixed on site. 2. Do not blindly move the injured part. 3. Avoid unnecessary handling. 4. On-site reset is strictly prohibited. Part 3. Basic elements of on-site fracture fixation. 1. Ideal professional splints, bamboo boards, sticks, pickaxes, gun stocks, etc. can be borrowed directly from the patient's healthy side limb or torso. 2. If there are wounds and bleeding, stop bleeding, bandage, and then fix the fracture site. If there is shock, anti-shock treatment should be performed first. 3. When dealing with open fractures, do not return the broken end of the punctured fracture to the wound to avoid. 4. The length and width of the splint should be adapted to the fractured limb, and its length must exceed the upper and lower joints of the fracture. In addition to the upper and lower ends of the fracture site, the upper and lower joints should be fixed. 5. The splint should not be in direct contact with the skin, during which cotton, towels or other cloth should be padded, especially at both ends of the splint. Bone protrusion and suspension parts should be thicker cotton and thick towels to prevent pressure or improper fixation. 6. Fixing should be moderately tight, so as not to affect blood circulation. When the limb fracture is fixed, the fingertip must be exposed to observe the peripheral blood circulation at any time. If the fingertip is found to be pale, cold, numb, painful, swollen, or blue, it indicates poor blood circulation and should be loosened and refixed. 7. Avoid unnecessary movement during fixation and do not force the wounded to carry out various activities. Part 4. Types and characteristics of fractures. 1. According to whether the fracture is communicated with the outside world. 1. A closed fracture. 2. Open fracture. 2. Or according to the degree and shape of the fracture. 1. Incomplete fracture. 2. Complete fracture. 3. According to the time of fracture occurrence. 1. Fresh fracture. 1. Well, weeks after fracture, manual reduction. 2. Old fracture more than 2 to 3 weeks after injury, difficult manual reduction. 4. According to the nature of fracture. 1. Traumatic fracture. External force on healthy bone iliac occurs. 2. Pathological fracture. The diseased bone is caused by light external force. 5 common types of fractures: thoracic and lumbar fractures. Judgment: 1. History of trauma. 2. Pain, limited movement. 3. Lower limb dysfunction. Handling requirements: 1. Lie on your back with your upper limbs on your sides. 2. 3 people stand on the injured side, requiring the correct position. 3. 3 people kneel on the injured side with one leg side by side and extend their arms into the shoulder and back of the injured person, wrist and hip, and below the lower leg. For one-person password: 5. Lift, walk, drop. The action should be consistent. 6. The injured person's body should be kept in a horizontal position and should not be twisted. 7. Gentle and smooth movements. 8. The injured person must be centered behind the stretcher. 2. Pelvic fracture. Judgment: 1. History of trauma. Height: 4. Crush, traffic accident. 2. Pain. 3. Limited movement of lower limbs. 4. Shock, urethral injury. 3. On-site fixation of limb fractures. Judgment: where there are annular tenderness, deformity, mobility disorder, pseudo-joint movement, and bone friction in the limb injury, it indicates the existence of fracture. The longitudinal percussion pain can also help identify the fracture site. When the above clinical manifestations cannot be confirmed or ruled out, it is advisable to treat fractures in on-site first aid. 4. Fracture of the upper arm. Hold the upper arm with 2 to 4 pieces of wood, wrap the cloth and fix it, and bend the forearm and stick the elbow to the chest. When there is no fixed material, bind the upper arm close to the chest. 5. Fixation of lower leg fracture. 1. Use 1 to 2 pieces of wood, the length from thigh to foot, placed on the outer and inner sides of the calf and tied with quad straps. 2. Only 1 piece goes on the back of the calf, outside with strong limbs. 3. When there is no fixed material, the affected limb can be temporarily fixed on the healthy limb, and the middle space can be filled with cotton, pillows, and cloths. 6. Rib fracture, single rib fracture. The chest band is bandaged to limit chest movement, reduce pain, and reduce secondary injury. 2. Chest wall softens. Cover the softened area with dressing or other similar material and wrap with a chest strap. 3. Open pneumothorax. Wound was filled with dressing, chest strap immobilization, thoracopuncture, suction, and decompression. If no syringe is available, release the dressing on exhalation and press the dressing on inhalation. The above content is that we learn about the fracture fixation and handling. That's all for this class. Thank you.